If this is the first time you're meeting me, I'm Shalene Massey. I'm a certified doula and childbirth and postpartum educator, and I've been in practice since 2012, and I'm considered an experienced doula. At the recording of this video in early 2018, I've supported over 150 couples during their birth and as an educator. And I want to talk about the role of a doula and common questions regarding doula support. So what is a doula? In Greek, the word doula means woman's servant. And the doula provides emotional, mental, and practical support during pregnancy, birth, and postpartum. And a common question is, what's the difference between a doula and a midwife? Or is the doula the midwife? And they're very different. The midwife is the person that is delivering your baby and providing the support and safety for your labor, for monitoring the baby, making sure the baby is safe, and is your care provider, or like the OB if you're in a hospital setting. And the doula's role is to provide emotional and practical support for your labor and helping you cope with the intensity of labor, however you're planning to birth and however your labor unfolds. The doula is helping you to cope with labor and does not do anything medical, does not do any cervical exams, blood pressure checks, or take any blood from you, and is really helping you, the mom, to cope with labor, to help you understand what's happening with labor, to answer questions, and to really help you and your partner to navigate the labor process and to feel at ease and at peace emotionally, and to lower the anxiety, which is huge to have that kind of support with you during labor. And to have a doula is to really help you to know that that person is comfortable with birth and comfortable with seeing you in pain and uncomfortable. Labor is intense. Regardless of your plan for birth, you're going to experience some pain, some intensity, and the doula and myself is very comfortable with seeing a woman experience labor. It is beautiful to me to experience labor with that woman and to see her at her most raw, vulnerable self during labor. And that might be hard for your partner to experience with you and to see you in that place and to see you acting in ways that you may not act normally. I teach a thing called Laborland, and a woman enters into Laborland in transition of labor. When you're unmedicated, you enter into this different place, and it's important to have a doula or somebody present that notices that shift, that notices that transition. Your partner may or may not notice and may or may not know really how to handle that shift. The doula is very comfortable with noticing that shift and when that happens and helping you navigate that transition and preparing you for the rest of your labor and for the pushing and delivery phase. Another common question is, do doulas only do home births? I support women however they plan to birth and wherever they plan to birth, whether in a home, whether in a hospital, whether you're planning a natural or low intervention birth, planning interventions, planning an epidural, or planning for a cesarean birth. I support couples with whatever kind of birth they're planning and in a hospital setting. Some doulas, including myself, also offer acupressure and body work. I help women to stimulate labor during labor if labor stalls through acupressure, or at 41 weeks or so, depending on each client. I offer acupressure massage to help stimulate labor if labor is delayed past your estimated due date. I also do postpartum body work. You might be wondering, why hire a doula or a support person? The doula is there to help you emotionally and mentally, and the mental aspect is just as important as the physical. What's happening in your mind greatly affects the physical. I teach pain coping practices, and you will learn practices to help you tune down the chatter and to help you get out of your thinking mind. Your partner and I are there to help you to get out of your thinking mind, to really be into your body and be internal with what's happening with your labor as you're coping through labor. And that is part of a doula's role, is to help you really stay present with what's happening during your labor and not being focused on the outcome, not being focused on what's to come, where you're going to deliver, how you're going to deliver, really helping you stay with each contraction, That's what a doula's role is, and to help your partner navigate all of that, to help your partner understand what's normal, what's abnormal. There are lots of gray areas in the normal, abnormal textbook labor, and a doula really understands that, really knows when labor is normal and it's chaotic and there's lots happening physically and emotionally, and can help your partner realize this is labor. This is what it's like. It's intense, and help your partner really lower their anxiety and your support people and you when you're vomiting, when you're pooping, when all these things are happening. And that's how labor is. That means your body's working hard. And when something happens that may be not normal or abnormal, and something happening that's outside of your control, that may require some kind of intervention, helping you embrace that, helping you understand what questions to ask, the pros and cons of different interventions, and helping you navigate the next best thing, regardless of what's happened prior during your labor or what's to come, and not thinking about what's happened or what's to come, and not judge yourself or criticize yourself with how your labor is going, or thinking your body's broken, or wondering, should I have done this, should I have done that? All those things increase anxiety, and the doula's role is there to help you stay present, stay focused, understand the facts, help you navigate the facts and asking questions. The doula does not make decisions for you, medical decisions, but can help you understand the pros and cons, help your partner understand what to ask your care provider, what to mention to your care provider, and really becomes your support person and advocate during your labor. You might be wondering, what if I'm planning to get an epidural? Will I need a doula? Well, I would say yes. Regardless of how you're planning to birth, labor and navigating all the aspects of questions, when to go to the hospital, what to do when certain things arise, it's important to have a doula and somebody that understands all of that and is experienced with birth. Nobody knows how your labor is going to unfold, or how you're going to birth, or where you're going to birth, even if you're planning a hospital or a home birth. I've had clients that planning a home birth that transferred to the hospital, and planning a hospital birth that ended up birthing at home. And having a doula there can help with all the unexpected surprises and things that arise during labor. Even if you're planning a cesarean birth, I've had clients to hire me that wanted me there to help lower the anxiety when they're planning to go for a cesarean, or to just help, again, navigate all the aspects of birth, and helping their partner, really being the support person for their partner. So however you're planning to birth, wherever you're planning to birth, a doula's role can really be important to help you to really have an empowering and beautiful experience for your birth. Another common question is, will the doula take the place of my partner? Absolutely not. When I meet with couples, I always talk about how I work very closely with the partner, as helping your partner to know when to take breaks, to feel comfortable to rest. I've had partners to sleep many hours during the night when I stay up and really observe and help support you while you're in labor, where I can go home and rest after your birth, and your partner may or may not be able to after the baby's born, and really help you to rest after labor and take care of the baby. So it's important for your partner to feel supported. And I also really work with a partner where your partner may know you or does know you differently emotionally and more connected to you as your partner. And I can help with the practical aspect and navigating the practical aspect where your partner, may or may not be taking a class or learning lots prenatally about birth. But it's easy to forget. There are lots of things to remember during your labor as your labor unfolds, and your partner is going to feel anxious just like you. And the doula is very present, very calm. I'm very calm and very present when I come into your birth, and I can remember all these aspects. I embody birth. I teach birth, and I've been doing it since 2012, and it's very natural for me to navigate all the surprises and unexpected things about labor and your partner may not be able to. And I help to remind your partner of things to do. If I see a way that your partner can be more involved physically or practically, I put your partner there in place of me, and I say, hey, why don't you do this? Why don't you rub her back this way or her shoulders? Or why don't you set this part of the room up to help when we move to this contraction? Lots of different ways that I help work with your partner, and I don't take the place of your partner. I help your partner be more involved and know how to support you. It's also important to ask your doula or ask the doula you're interviewing, how does she work with the medical staff? How does she interact with the medical staff? And just like you might ask your provider, do you refer to doulas? Do you work well with doulas? Ask that of your doula and notice how she responds. I have care providers and doctors that refer to me, and I work very well and have a very good rapport and feel respected by the providers and the nurses in the hospital or a home birth setting with midwives. And I know my boundaries as a doula, I know my role as a doula, and I know the doctors and nurses' role, and I complement and work with them. And I also let them know what I'm thinking or what I might be suggesting to the couple, and get their feedback and say, hey, what do you think about such and such? And to get them involved with what I'm thinking about the labor plan, maybe while he or she is out of the room. And I work as a partner and as a team with the providers and the medical staff. I don't come in a threatening way or like I know everything. I very much respect what they know and their knowledge and their skills, and I trust that with most providers. And I feel like they trust what I do, and they trust my labor support, and they let me help you and support you and help you cope with labor. And we work well with communication. It's important that your doula communicates well with the provider and the medical staff. You might be wondering, what services do I offer? I have a bullet point list of services on my website, and I'll post those in the bottom section of the write-up of this video. What I've learned, the more experience I've gotten as a doula, my intuition has greatly increased. And I don't have a bullet point that I'm thinking through in my mind when I'm at your birth, but I'm very intuitive, I'm very observant, and I'm asking, what does this situation call for during your labor? What does she need, this person need, with what's happening with her labor? What's happened prior during her labor? What are her goals? What does she desire? And I help in that moment. My intuition really helps. I may use all of my labor tools, all of my tricks and experience. I may use none of them, and really just be present, helping you with eye contact, helping you with your breath, helping you verbally, or maybe via phone. I offer virtual doula services, and I may work with you just by video or phone support. Maybe you don't want an extra person in the room, and maybe you don't have a doula in your area that you feel comfortable with, and you can contact me and we can do phone support. We can do video, Skype or Zoom support, and I can help you navigate all the questions, all the aspects of labor as your labor is unfolding. Even in the middle of the night, I can be on call for you to call me when you have a question, when you're feeling concerned or when you're anxious, even on video to talk you through contractions. Your partner can hold the phone or the iPad and next to you, and I can help you through those contractions and navigating your labor virtually. So I encourage you, if you are not local to me in Virginia, in the New River Valley, Virginia, to contact a doula locally if you want in-person support, or contact me and we can talk about virtual support. And if you are local to me, I would love to meet with you and share how I can support you and your partner. So send me a message or contact me and set up a time to meet. Blessings on your pregnancy and birth and postpartum journey.